Hello, Mr. Way.
Hello.
Hi, Mr. Way. How are you?
I'm doing fine. Nice to meet you.
Good. My name is Kim Wagner. I'm a PA, and I'm going to ask you some questions and do a physical exam on you today.
All right.
Okay,
Glad
great.
to get started.
Yeah. Tell me what brings you in to see us today.
Well, my back's been hurting me a lot. Yesterday, I was coming out of the shower, and I slipped on the floor, and I fell right on my butt.
Oh, my goodness. So where exactly does it hurt?
It's just kind of, it's just kind of right here, right near my butt, right in the bottom of my spine.
Okay, alrighty. Does that radiate anywhere else, or does it just stay right in that area?
No, it's just kind of right there. It doesn't go anywhere.
So no pain down in your legs or down into your feet or anything like that?
No, I've hurt my back before, but nothing like this.
Okay, alrighty. So nothing, this kind of pain you've never had before?
No.
Okay, alrighty. Tell me, on a scale of 1 to 10, 1 being very minor pain, 10 being very severe pain, where do you rate that pain?
It's not as bad as when I broke my leg, so I would say this is about a 4 or 5.
Okay, okay. And you said this happened last night?
Happened last night,
Okay.
getting out of the shower.
Since it happened, has it gotten better, worse, or is it about the same?
No, I'd say it's about the same.
About the same.
It
Okay.
hasn't really gotten any better.
It hasn't. So you haven't been able to find a particular position or anything that makes it better?
No, I really couldn't sleep last night. I had to get on the recliner and just go to bed.
Okay, so you slept in the recliner last night. Were you able to sleep in the recliner, or were you pretty restless?
No, I was pretty restless.
Okay, all right. Is there anything that you found that makes it any worse?
Just kind of sitting on like these chairs you guys got here in the
I
front.
notice you're kind of wanting to sit kind of maybe on the
Yeah.
side or not right on that.
They're
that
not
particular-
comfortable chairs.
Yeah, okay. All righty. And you said you've hurt your back before, but in between those injuries, is your back, can you do everything that you need to be able to do, or?
Yeah, I'm getting pretty old, but I can still get about walking. I do a lot of walking and gardening.
Good,
But-
so you're pretty physically active then still, that's great.
Yeah.
Good deal. Alrighty, and you haven't found anything necessarily that makes it worse. You said just kind of sitting. Does it feel better if you're laying down or if you're sitting upright?
I think just kind of maybe a little bit in between, not really lying, not really sitting, kind of like just stretching
Just
back
kind of
like
lean
that.
back a little bit.
Yeah.
Okay, how about when you're standing?
I don't really think it makes it better. It doesn't make it worse. It
Okay.
just stays the same.
Okay, and walking around with actual activity, does that make it any worse?
No, that doesn't make it worse.
Okay, did you try any medication last night or this morning over the counter, or?
Well,
What you
I tried some ibuprofen, and that seemed to help a little bit.
Okay, all right, some ibuprofen, that's the only thing you've taken for it?
Yeah, just a
Okay.
couple of ibuprofen. I took a couple of ibuprofen over the counter, and that seemed to help a
So
little
they were
bit.
like 2 of the over-the-counter, the 200 milligram ibuprofen?
Yes.
Okay, alrighty. Are you on any other prescription medications for pain at this time?
I take some medicine for high blood pressure, and I take some medicine for gout.
Okay, do you know what the names of those medicines are?
No, I take the high blood pressure. I think it's a water pill. I take it once a day.
Okay,
And then the gout, I take it also once a day, but I don't remember the names.
you don't know the names of either one of those, and you didn't happen to bring those with you today or anything like that?
No, I forgot to bring them.
Okay, so that's real important that you have your medicines with you, or have a list, so maybe when you get home, you could write down a list so you have it with you the next time.
All right.
So tell me, have you had any changes since last night? I know this has been fairly recent, but have you had any changes in your bowel or bladder habits at all? Urinating more frequently, having pain when you urinate, anything that's kind of different or stands out?
No.
Nothing, okay. And how about bowel movements? Have those been normal, or have you had a bowel movement since you had this fall?
I haven't had a bowel movement.
Okay,
But
so you haven't noticed anything different in that area? Okay,
No.
alrighty, good. No incontinence in the night? I'm sorry, that means when you had like an accident or leaked urine in the night?
No, nothing like that.
Okay, alright, great. So you mentioned you have high blood pressure and gout, and about how long have you had those conditions?
Oh, probably, let's see, the high blood pressure, I've had it I'm 88, so I've had it probably for a good 20 years, I think.
Wow, okay. And you've just been on the one medication?
Right,
Okay,
right.
great.
And the gout, I've had it for about 5 years.
About
and
5
I've taken
years,
that
okay.
medicine for about 5 years now.
Okay, and are both of those conditions considered controlled? Does your blood pressure run normal whenever you check it?
Well, when you check it, I wouldn't be surprised if it's kind of high now.
Today,
but
yeah.
no, it's pretty good with my
Normally
blood
it's
pressure,
pretty
and
good.
I haven't had a gout attack in 2 years.
Oh, that's good, that's good. Does anybody ever monitor either one of those things, so check lab, you know, every 3 or 6 months or anything like that?
Yeah, I have a doc, you know, at my regular clinic,
Okay,
and I'm due for annual checkup next month.
okay, so you'll have that checked, but so far everything seems to be fine.
Yes.
Okay, wonderful. Do you remember a recent reading on your blood pressure? You say it's pretty well controlled, but do you know what's kind of normal for you?
I think around 130 for the top number, and the bottom number is maybe somewhere around 80s.
Okay, alrighty. Now, so the two medications that you're not sure of the name of, and it's just the two, there's just one for blood pressure, okay. Anything that you take on a regular basis over the counter?
Take a vitamin pill.
A vitamin?
Yeah, I take
Okay,
a vitamin.
just a multiple vitamin? or-
Multivitamin.
Okay, and that's all? You don't take any aspirin or?
I take
other
aspirin.
vitamins? You
Yeah, I
take
do
an
take.
aspirin?
I do take a regular aspirin once a day.
Okay.
The doc told me to do that.
Okay.
And then the vitamin.
So an aspirin, a vitamin, and then the two prescription medications.
Right.
Okay, very good. Do you have any allergies to any medications, foods, or topical things that come in contact with your skin?
No.
None of those. Okay. And have you ever had any surgeries?
No, I've been lucky. I haven't had any surgeries.
Never a surgery or a hospitalization either?
No.
Good.
No.
That's wonderful. Okay. Anything else that you want me to know about your health or what you've got going on today?
No, just if you can help me figure out what's going on with my
Right,
back, and,
okay.
and that'd be good.
Okay, very good. Well, I'll step out of the room. There's a gown here. If you'll just kind of disrobe, you can leave your underwear on, get into the gown, and I'll come back and we'll do an exam.
Great.
Okay.
All right. See you in a
Great.
bit.
All righty.